Hello and welcome to your State Health Benefit Plan video guide. I'm Dale and we're out here at beautiful Lake Allatoona in Acworth, Georgia to bring you some very important details on your plans for the upcoming year. This presentation is intended to provide a brief overview of the plan options available to you for the 2015 plan year. We're also excited to have a helpful tool a little later to help you choose the plan that's best for you. If you'd like more detailed information, visit the State Health website. Employee benefits play a large role in most of our overall financial planning, so it's important to understand them. The most important piece of your employee benefits is your health insurance. Your health insurance is now available from 3 carriers: Blue Cross Blue Shield of Georgia, United Healthcare, and Kaiser Permanente. This year, you have various types of health plans to choose from. A health reimbursement arrangement, or HRA plan, offered through Blue Cross Blue Shield of Georgia only. A health maintenance organization, or HMO plan, provided by Blue Cross Blue Shield, United Healthcare, and Kaiser Permanente. And a high deductible health plan, or HDHP, offered through United Healthcare. For Blue Cross Blue Shield and United Healthcare, Express Scripts is your pharmacy provider and Healthways is the wellness provider. Kaiser Permanente administers their own pharmacy and wellness services. For each plan, you'll receive one ID card for your medical, prescriptions, and wellness benefits. Before we dive in, let's review some general differences on health plans. An HRA plan provides both in and out-of-network benefits. There are deductibles that have to be met. However, first dollar coverage is available through HRA credits provided by the State Health Benefit Plan. After your deductible is reached, you then pay a co-insurance percentage up to an out-of-pocket maximum. An HMO provides in-network services only, except for emergency care. Depending on the plan you choose, you may be required to select a primary care physician. Some services are covered by copays, while others are subject to a deductible up to an out-of-pocket maximum. A high deductible health plan, or HDHP, has in and out-of-network benefits. Under this plan, all covered medical and pharmacy expenses, except for preventive care, apply toward the deductible first. After your deductible is met, you then pay a co-insurance percentage up to an out-of-pocket maximum. It's important to note, preventive care is covered at 100% under all plans through in-network providers only. Also, be aware that prescription drug coverage and provider networks vary from plan to plan, so be sure to review your needs carefully when choosing the best plan for you and your family. Well, now that you're all insurance gurus, let's get started.
Hi, I'm Erin and I'm here to tell you a little bit more detail about the plans. The HRA plans are provided by Blue Cross Blue Shield of Georgia. Blue Cross Blue Shield has an extensive network of doctors and other healthcare providers. Referrals are not required to see a specialist and there are no pre-existing conditions. You have 3 HRA plans to choose from: Bronze, Silver, and Gold. They are all a part of the Blue Choice Open Access Point of Service Network, providing both in and out-of-network benefits. Each of the plans provides the same coverage, such as doctor visits, outpatient and inpatient hospital care, emergency coverage, and preventative care. You will no longer pay co-pays for your medical and pharmacy expenses. Instead, you pay the applicable deductible and/or co-insurance. Coverage for prescriptions is also the same for each of the 3 plans, and the deductible does not apply. Instead, you'll pay a percentage of the cost of the prescription based upon the tier the drug is in, with a maximum dollar amount for each tier. All 3 plans have a health reimbursement account, also known as an HRA. The HRA is funded by state health and is like free money for you to use for certain out-of-pocket expenses such as your plan's deductible, co-insurance, or pharmacy expenses. There is a base HRA credit given for each plan. Depending on which plan you choose, the initial HRA contribution is different. We'll come back to the HRA credit in a moment, but first let's take a closer look at the differences between the three health plans. As mentioned earlier, covered services are the same for all three plans. The difference in the three plans is found in the deductibles, coinsurance levels, and out-of-pocket limits. Coinsurance is a percentage of the total cost of care that you would have to pay after a deductible has been met. The Bronze plan has the highest deductible and out-of-pocket limit compared to the other HRA plans, but with the lowest premium cost to you. Should you meet your deductible, the plan will pay 75% of covered in-network medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. Don't forget that your deductible and pharmacy benefits can be reduced with the HRA contribution. The Silver plan has a lower deductible and out-of-pocket limit than the Bronze plan. However, you'll note that the premium cost to participate in this plan is higher than the Bronze. After meeting your deductible, the plan will pay 80% of covered in-network medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. This plan also has a higher contribution to your HRA account. The Gold plan, you guessed it, is the highest premium cost HRA option. It offers the largest HRA contribution, the lowest deductible, and the lowest out-of-pocket limit. After meeting the deductible, the plan pays 85% of in-network covered medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. Don't forget, the coverage for prescription is the same for each of the HRA plans. HRA credits can be used for pharmacy expenses, and they do apply towards your out-of-pocket maximum. Pharmacy expenses do not apply to the deductible. A mail order benefit is also available. An HMO plan is a health plan that directs your health care through in-network providers only. The HMO is a little different in that there are 3 carriers offering this plan type. 2 of the providers, Blue Cross Blue Shield and United Healthcare, offer an HMO that is available statewide. The 3rd carrier, Kaiser Permanente, requires members to live or work in the 27-county Atlanta Regional Service Area. You can find this and other information in your State Health Decision Guide. The HMO is also the only plan you have available that has copays. A copay is a flat fee you pay for covered in-network services, such as eligible primary care and specialist office visits, emergency room care, urgent care, and retail health clinics. After a copay, the plan covers 100% of the eligible costs. In statewide HMO, certain procedures, such as inpatient hospital care, will require the deductible be met before any coverage is available. Should you meet your deductible, the plan will pay 80% of covered in-network medical charges up to the out-of-pocket limit. After the out-of-pocket limit is met, the plan pays 100% of covered charges. For prescription drug coverage in either HMO plan, there are no deductibles that have to be met, just copays. The copays do not count toward your deductible, but do count towards your annual out-of-pocket maximum. Please note, because Kaiser Permanente is a fully insured product, Kaiser Permanente will administer the member's pharmacy and wellness benefit directly and will not administer the pharmacy benefit through Express Scripts. The High Deductible Health Plan, or HDHP, is offered through United Healthcare. Its purpose is to allow you to share in higher deductibles, coinsurance, and out-of-pocket levels in exchange for the lowest monthly cost of all available plans. Your HDHP has both in and out-of-network benefits. While preventative care is still covered at 100%, all other procedures are subject to a deductible first. If you have family coverage, you'll be required to meet the entire family deductible before any benefits are paid. After the deductible has been fully met, the plan pays 70% coinsurance in-network up to the out-of-pocket maximum. Prescriptions are subject to the deductible and do count towards the annual out-of-pocket maximum. Referrals are not required to see a specialist, and there are no pre-existing conditions. With this plan, you may qualify to establish a health savings account to set aside tax-free dollars to pay for eligible health care expenses. See your State Health Decision Guide for eligibility rules. To get the most efficient use of a high deductible health plan, any savings from the monthly cost should be saved to help with future out-of-pocket expenses. Now let's take a few moments and look at some examples that may help you decide which plan is best for you.
Hi, I'm Travis. As we consider which option may be best for you, let's consider there are 3 types of users: low, medium, and high. A low user may look something like this. You see a primary care doctor once, have 1 MRI, and take 1 prescription each month, which falls under Tier 1. A medium user looks like this. You see a primary care doctor twice, also see a specialist 4 times, and have 1 outpatient surgery, and take 2 prescriptions each month. 1 falls under Tier 1 and the other in Tier 2. A high user looks like this. You see a primary care doctor twice, a specialist 10 times, have 1 hospital admission, and take 3 prescriptions each month. 2 fall under Tier 2 and 1 under Tier 3. Now ask yourself, which one of these best fits your situation? Let's walk through each of your benefit plans. First, let's look at a low user. There are 2 types of expenses for you to consider. The first looks at how much you pay out in benefits, such as your copays, deductible, and coinsurance. You also pay premiums each year for your insurance coverage. But what's really important to you is your total out-of-pocket cost, which is shown at the bottom. In this instance, you may want to consider the Blue Cross Blue Shield Bronze HRA, UHC High Deductible Health Plan, or the Kaiser HMO. Make sure to look at your doctors and other providers to ensure they are covered. Now let's look at a medium user. Again, you need to consider what you will pay out in benefits as well as premiums. In this situation, you will notice that Blue Cross Blue Shield Gold is the lowest cost HRA plan, with Blue Cross and Kaiser for HMO options. Again, it's important to look up your doctors and other providers to ensure they are covered. Lastly, let's look at a high user. Here you will see again that Blue Cross Blue Shield Gold is the lowest cost HRA plan, along with Blue Cross Blue Shield and Kaiser for HMO options. Keep in mind that State Health Benefit Plan has also included 3 decision support tools which allow you to customize your specific personal situation. Every individual situation is unique, and it's important to carefully evaluate your options.
So how do you earn well-being incentive credits in each of the plans? By participating in the Healthways Wellness incentives, you have an opportunity to earn even more credits for your plan. The wellness incentives can, in total, add $480 in wellness credits. And if you have a spouse who is enrolled and participates, another $480. Here's how this works. Step 1, assess your health. Complete a confidential online well-being assessment. It'll take about 20 minutes. And step 2, know your numbers. Complete a biometric screening at your participating doctor's office or at a state health-sponsored screening event. Complete both of these and earn 240 wellness dollars. Step 3, you can accumulate up to another 240 wellness dollars in $40 increments when you take action. You choose between 2 coaching sessions completed over the phone or track certain well-being activities online or a combination of the 2. More information on this can be found at bewellshbp.com. So again, that is up to an additional $480 for you and any covered spouse if you both complete these incentives. In the statewide HMO plan, these well-being credits can be used to help offset certain healthcare costs like copays and deductibles. In the HDHP plan, they can help offset deductibles, but you cannot use your wellness credits on the HDHP until you have paid $1,300 in covered services for the employee deductible and $2,600 on the family deductible. In the HRA plan, these credits will be added to your HRA account. You will not lose any unused HRA dollars if you keep your HRA plan. Any unused HRA credits from current or prior years will roll over into your HRA account for next year. If you should move from the HRA plan to the HMO or high deductible health plan, you will lose all of your accumulated HRA credits. Kaiser Permanente administers their wellness benefits directly. See your decision guide for more details. In closing, some last items. Don't procrastinate. 300,000 plus members all need to make an election in the same 19-day period from October 27th to November 14th at 5 o'clock p.m. Make changes as often as you like. The last change you make before your election period closes will be your election for 2015. Be sure to click the Finish button, then print the confirmation page and keep for your records. One important note, if you fail to make an election through the website, you will default into the HRA option you chose for 2014 without copays. If applicable, you will continue to pay the tobacco surcharge you were paying in 2014. If you did not pay a tobacco surcharge, you will not pay one if you default coverage. The State Health Benefit Plan offers health care coverage that is affordable based on employee wages and meets the minimum benefit requirements as they relate to the Affordable Care Act. So government assistance on the federal exchange will not be available to you. You can choose to decline to enroll in one of the state health plans and choose a plan on the federal exchange. But consider that if you do, you will be responsible for the total cost of the coverage you buy, and the cost for the coverage cannot be deducted from your paycheck. More information on these plans can be found in your State Health Benefit Plan website, where much information, such as the Employee Decision Guide, videos, and cost calculators are available through your employer. Well, that wraps it up. We appreciate all you do and thank you for spending your valuable time with us.